Good day and welcome to the Prime Feed News. I'm John Smith. Build One South Africa Bosa leader Maimane has challenged President Cyril Ramaphosa and his cabinet to cancel their private medical aid cover and use public hospitals before signing the National Health Insurance NHI Bill into law. Ramaphosa will sign the bill into law today after 5 years of fierce debate since it was introduced to Parliament in 2019. Though government promises the NHI will provide improved health coverage to all South Africans, its implementation has been met with opposition and skepticism. Before he signs the NHI bill, I challenge the president, his family, the cabinet, and their families to cancel their private medical aids and use public health care immediately. There must be no health care obtained overseas, said Maimane.
It is often said your health is your wealth. The National Health Insurance, as envisaged by the ANC, is going to be devastating for this country. You'll have profound skills flight out of this country, and ultimately it will drain the fiscus. This is a 500 billion rands investment that needs to go with a government that is already heavily indebted, incapable of managing financial resources, and ultimately has allowed the public healthcare sector to collapse with poor leadership at multiple places. I can assure you, citizens will not be able to get the best healthcare. Ultimately, as practitioners leave, you'll end up with healthcare being outsourced elsewhere. Look at countries like Zimbabwe, etc. Their leaders could not even stay in their countries for healthcare. They ended up dying elsewhere. So we've got to be intentional about this bill. We've got to reject it with everything inside of us. As fellow South Africans, Build One South Africa, we've always maintained that a dual system works effectively, and one of the key interventions you can put on the table is to ensure that you make it possible for the best leadership to be appointed in hospitals, that at the primary healthcare level, you ensure that the state acts as an underwriter, so that whether you are living in Limpopo or you are living elsewhere or in any other community in South Africa, you are able to go to a private facility looking for primary healthcare support, and the state can underwrite that transaction. Ultimately, it goes the other way also. That if you're a medical aid holder and you want to go to a public hospital, i.e. Grooteskier, and looking for hepatology services, you are able to go there and your medical aid can pay the public health care. So a dual system is crucial. It will not be a drain on our fiscus. It will make sure that millions who are already in private medical health care don't have to be added onto the public healthcare system, that you can maintain that. And ultimately, we can ensure that through regulation of ensuring that all medical aids provide the best service possible, that the cost of medicine is reduced, that we can ultimately build a coverage of healthcare across the country. This model has been tried in various countries and ultimately is the most effective way to ensure that you do not collapse your healthcare system, but you ensure that all citizens can get the best healthcare. Let's reject this bill. I'll be fighting with everything, and we're looking at our legal options going forward.
He had no hopes the scheme would succeed in South Africa under ANC governance. The NHI as envisaged by the ANC is going to be devastating for this country. We will have profound skills flight, and ultimately it will drain the fiscus. This is a 500 billion rand investment. The government is heavily indebted, incapable of managing financial resources, and has ultimately allowed the public healthcare sector to collapse. Akshinsa leader Herman Mashaba expressed disappointment, saying Ramaphosa ignored pleas not to sign the bill. We urged President Cyril Ramaphosa to not sign it into law in December last year. The NHI will not fix South Africa's broken healthcare system. Instead, it will worsen our healthcare crisis and open doors to more corruption, he said. DA leader John Steenhuisen threatened legal action against the government. The DA will immediately file a court challenge all the way to the Constitutional Court soon after President Cyril Ramaphosa signs the NHI bill into law, he said. The legal battle underscores the DA's position that the NHI could undermine the quality of healthcare and potentially infringe on citizens' rights, he added.
The Democratic Alliance will, upon its signing into law by Cyril Ramaphosa, challenge the ANC's NHI all the way to the Constitutional Court. Our legal team was briefed months ago already and will file our legal challenge against this devastating legislation without delay. We have built up reams of correspondence, including with Ramaphosa himself, that we will enter into evidence to show that the process which led to the adoption of this bill by Parliament disregarded public input, and that the bill itself is flagrantly unconstitutional. But we will not stop there, because our furthermore pledge today before the nation that if this country elects the DA into national government on the 29th of May, we will immediately repeal the NHI bill and prevent it from destroying this country.
Rism's Ansi Songezo Zibi described the NHI as a misleading solution proposed by the ANC. He said real improvement in health care would come from ensuring public facilities are accessible and well-resourced. The signing of the bill has brought to light deep-seated concerns about the future of health care in South Africa. Some argue that the NHI could lead to increased corruption, a decline in health care quality, and a misallocation of resources.